stay on schedule here. Thank you, everybody, for joining. My name is Chris Jones, and I'm a Rocky Mountain Public Health Training Center project coordinator and the communications director for CPHA. Just a quick couple housekeeping items. If you could mute yourself during the session, that would be ideal, so we can stay on topic here with Adam's presentation. And we will have time at the end for Q&A that will be facilitated by Marissa Westbrook. Should you have any issues with Zoom, hearing issues with audio or connectivity in general, please message us in the Zoom chat. We have a session support here. Her name is Mia Crandall, and we will get you up and running if anything comes up. So I will now hand it off to my colleague, Marissa.
Great, thanks, Chris. Hi, everyone. Thanks so much for joining us today for the CPHA Health Equity webinar series. We're really excited today to have Adam Anderson speaking to us. He is the Health Data and GIS Supervisor. GIS is Geographic Information Systems at Tri-County Health Department. He's also the Colorado Public Health Association's President-elect, and his background is in urban and regional planning and public health. So we're really grateful today for the opportunity to hear about using GIS for health equity. And I'll pass it off to you, Adam, to get us started.
Thanks, Chris and Marissa. There are a couple things I just want to make announcements for as well. And one is that for those of you who may not know, CPHA has just gone under new management. So we left Civica and we are now with a company called The Solution. And so I hope that this is we plan this to be as seamless as possible, but obviously that's not always the case. So if anybody has any issues with their membership or with any of the upcoming conferences or just in general, please let us know. Our address has changed. Our main email, info@Colorado Public Health Association or coloradopublichealth.org is the same, and we have a new account manager that is they're very responsive, so they can deal with any issues pretty quickly. And so again, just let us know if you experience any issues. I also want to make an announcement about Culture of Data. So Culture of Data is Friday, April 10th. So if you're not aware of that, or if you haven't registered, please do so. The theme is looking at how we can incorporate data from different topic areas and begin to address issues around health equity. Also, Public Health in the Rockies abstracts are now open. So if you have anything to present, please submit an abstract. We'd love to hear from everybody. And then if you are not a member, we'd love to have you join CPHA. We have been working very hard to put together resources such as this for our membership, and hopefully you find these beneficial. I think that these health equity series webinars are especially important because health equity is something that we are all actively thinking about, and depending on which agency we are working with, we operationalize these concepts around health equity in different ways. Some people are really good at putting together data, while others maybe focus more on community engagement. And so I think that a benefit of these webinar series is that we can learn from what each other are doing around these topic areas. And I think that's going to be the best way that we can really figure out how we can address issues around health equity, both within our agencies and kind of collectively as a profession. So I really hope that these are helpful to you, and if you have anything that you've been working on that you found successful within the agency you work for, we'd love to hear from you and possibly present. So that said, again, my name is Adam Anderson, and I do data and GIS at Tri-County Health Department, and I am the upcoming president for Colorado Public Health Association, and I also teach GIS at the Colorado School of Public Health in the fall. So let's go ahead and get started. we're going to be talking about using GIS for health equity. A quick overview. What I want to answer is how we can enhance our understanding of social determinants of health and health equity using GIS. And I'm going to focus on three main points, which are using GIS to expand our understanding, the use and analysis of non-traditional health data sets, how GIS can be used to improve data visualizations to better understand issues with social determinants of health and health equity, and then how we can use GIS-based products to deploy web-based data communication tools to get a broader to create a broader understanding of these concepts. So really briefly, I know not everybody knows what GIS is, so I just want to kind of quickly describe what we mean when we say GIS. A lot of people think that it's just a software solution that Esri makes that people buy, but the idea of GIS is more that it's about the people that are kind of putting together these ideas, the software. So the software is not just ArcGIS. There's QGIS, Google Earth is a GIS. There's a lot of different ways that we can do mapping. And it also takes into account the hardware, the data itself. So having data that is spatially, that has a spatial component to it. And then understanding the methods by which we can analyze and incorporate geography within that analysis. So to get into the first topic, so that's expanding our understanding, our use and analysis of non-traditional health data sets. And again, this is within the context of just understanding social determinants of health. We're going to focus on a couple points within that. So just assessing data sets across different topic areas, being able to look at multiple data sets with thousands or perhaps millions of records, assessing multiple indicators at a varying geographic scale, and then understanding that spatial relationship between the indicators that we're interested in. So King County Public Health does a really nice job, or they did a really nice job putting together this sort of kind of flow diagram of what contributes to health. And I think a lot of us are pretty familiar with these concepts, but I think it's still important to kind of go over this, because when we talk about social determinants of health and health equity, we need to understand what indicators are important to illuminate issues within that context. And so when you look at this diagram, you can see kind of all those things that we talk about related, that can be related to health. So housing, jobs, education, food systems, the justice system, the built environment, economic opportunities, the neighborhoods we live in, parks. So all those things that we discuss around what are those things that kind of all contribute to our ultimate health. And then at Tri-County, we put together a similar diagram. It's a little bit more simplified. This is based on community input during our community health assessment, but we established that social connections, opportunity, health and wellness services, the neighborhoods that people live in, and safety were kind of the main concerns of our residents, and that falls in line pretty closely with what King County had put together as well. So a lot of those things are repetitive, but again, these are the concepts that we're constantly bringing up and trying to understand how they impact our health. So when we begin to look at what data is out there around these topic areas, I started listing off a lot of them to the side. So again, housing, jobs, education, food. We can go through the list of those aspects that are important. And when we look at where we get that data from, I'm not going to read out all of these, but if we say we look at housing, we can go to the American Community Survey and we can get the number of people per household, the percent of money that families spend on rent or their mortgage. And this is not meant to be an exhaustive list of data sets. These are just common data sets that we use when we begin to address these topic areas. If we look at jobs, we can look at the State Demographer's Office puts together some really nice economic forecasting to look at growth of employment within different sectors. You can also get that from the Labor Department. For education, we can look at graduation rates and educational attainment through both the State Education Department, in addition to data from the American Community Survey. With food or healthy food data, we look at food retailers from our own food inspection programs here at Tri-County. For the built environment, that can range from a lot of different data sources depending on what you're trying to get at, but every jurisdiction within the state of Colorado, or I guess every jurisdiction within the entire country for the most part, you should be able to access your parcel data and zoning from the assessor's office and from your planning department. Judicial data we get from, we work with our judicial district to get crime data, but there are also sites that you can get crime data. And then transportation, we can look at commuting patterns from the American Community Survey. And if we look at neighborhoods, one indicator that's really helpful is how many people have moved into the neighborhood within the last 5 years to look at changes in the neighborhood, which is a big issue with how fast Colorado's been growing. And then obviously the health data, we can access through CDPHE, through their numerous surveys, surveillance systems, vital records, in addition to hospitalization data and some of the other, the Colorado Health Institute has their CHAS data. So there's lots of different ways to get at these topic areas. And again, this is just kind of a sample of some really useful data sets specific to those topic areas. Interesting. It doesn't like that image. So it had a nice image of Boulder next to this, but the important part is still showing up. So we also look at a lot of demographics, and again, we get some really useful data from the State Demographer's Office. Those guys are extremely smart and helpful, and they have some really nice web-based tools that you can use to get demographic data from as well. In addition to that, we look at a lot of environmental data. So CDPHE publishes a whole host of environmental sites and potential exposure locations. And the EPA also has a lot of data related to exposure locations. And then depending on the topic you're interested in, you might pull from the specific regulatory division or agency that may be, say, the data steward for those data. And then community data. We look at, again, that can vary a lot by the topic you're interested in, but there's a couple data sources there that have some useful data. So that said, there's a lot of topic areas and a lot of ways that you can get this data, and it shows up in a lot of different formats. Let's see. And it's blank. Let me try reloading this, because this should not be blank. Sorry, bear with me. Okay. Yeah, let me reshare this. Okay, can everybody see my screen again? We good? Okay, yeah, now you get to see the nice picture that I put on the side of there. Let's see, let me go to full screen. Okay, so we have all of this data, and I think what we're really trying to ask when we get all of this data together is, what are the community characteristics we are trying to describe in the context of health, and how do they change across communities? And in other words, what are the social determinants of health important in each community, and how do they interact and manifest themselves in health? So we can begin. I just want to go through a series of images to bring up sort of different communities. I think these images do a good job of kind of eliciting a feeling of the differences in places in Colorado. So if we look at a suburban area, we might consider the access to open space or parks. However, transportation in terms of commuting patterns is different than other communities. For instance, if you live in a rural mountain town, your commuting is going to be very different. However, maybe parks and open space isn't quite as important given that you may be surrounded by mountains and public lands and all sorts of sort of natural amenities. Contrast that to, say, an urban, poor neighborhood without a lot of resources, the conversation becomes drastically different. We can also look at other urban areas where it seems like every resource has been planned out for the people that experience that place. And so the considerations here, again, are vastly different than, say, even the suburban areas or those mountain rural areas. We also have our exurban areas, which straddle between those urban and rural areas, which again have different considerations, and the way that those data pieces interact are going to be different here than in all those other areas. We also have communities that are not necessarily defined by their geographic characteristics, but maybe by just the population or the demographics. So we have agricultural communities, so that's defined by sort of the economics. We have communities of youth where they have different concerns than, say, different ethnic communities that we have across our state. We also have older adults, and so all these communities have different considerations, and the way that these topics that we're interested in interact across these areas or across these communities needs to be considered. And when we begin to look at data, and so we can look at data at the state level, and we need to understand that these things are have different interactions across different communities across the state. So if, for instance, we look at family income, and so say a family makes $60,000 a year, what is the effect of that if you're looking at Burlington versus Aspen versus Denver versus Pagosa Springs in the context of how much house you can buy, the quality of food that you can purchase, your child's education, or the healthcare that you can afford. So in Burlington, it may not be a matter of being able to afford your healthcare versus just the access to your healthcare, versus in Aspen, it may be you have access to all sorts of great healthcare, but you just can't afford it and you can't afford your housing. So acknowledging that these things have varying relationships and that social determinants of health are not a static sort of, we can't just make a static assumption about the relationship between that and our health across all of Colorado. So that regional context is hugely important. And so when we look at regions, we can Google Colorado regions and get a whole host of different regions. What those regions are attempting to do for the most part is sort of describe communities with similar experiences. And we can see that there's a bunch of different regions. Can break up into 4 regions, or in some cases it looks like there's maybe a dozen regions. So thinking about what that sort of context is that you need to assess your data and the community is critical. So we can take all of those data points that we discussed, and we can begin to think about them within the context of these different regions. So we have the Denver metro area, the Front Range, Western Slope. And so we can go through those knowing that again, the experiences of people there and the way that the social determinants of health data that we can collect is going to vary across those. And then to complicate things more, if we look at all of those data in the context of those regions, we can also begin to look at how those data are captured and actually break those areas down even more. So in Colorado, we have 64 counties, we've got 21 health statistics regions, we have 1,249 census tracts, we have over 3,000 census blocks, almost 300 municipalities. We have 264 neighborhoods in the Denver metro area, numerous zip codes. And so these are all kind of geographic entities in which people begin to say, I'm interested in this zip code, or I'm interested in what's going on in this city. And so we have to be aware of how we can collect these data, analyze them, and begin to make sense of those different communities. And so if we get that under control, we can begin to pull in we can download data, we can get all these tables. These tables might have, in the case of census tract, you might get 1,249 records with 100 variables related to race. And so it becomes really difficult then to really begin to make sense of this outside of a GIS. If you're tasked with this to do in Excel, it can be very daunting. So normally what we end up doing with data in general is we put together some descriptive statistics. So we like to look at bar charts, trend graphs, that kind of thing, and begin to summarize what's going on. So you could summarize housing characteristics in a municipality, or unemployment within a county or multiple counties. And that would provide you with some level of information, and you can look at it over time. And this is something I've put together that I feel like is fairly common, but you could just begin to put a line list together of all of those indicators for that city or neighborhood that you're interested in. And these are helpful and informative, but at the same time, what if we can get this into a GIS? What would that look like in terms of being able to understand that information within a more sort of comprehensive context? So if you can conceptualize pulling all these together as different layers, that's how it ultimately will end up in a GIS. So the first example I want to show you is just displaying the data. So obesity is a common thing that we look at. This is obesity in children, and just alone in this map, we have 144 census tracts represented, and we have 78 neighborhoods. And immediately, you can begin to make sense of what's going on. You can pull out some very sort of defined clusters. You can see that it's not an even distribution across Denver in this case, and that there's certain areas that are experiencing higher rates of child obesity than others. And so right there we can see that that the darker blue, or the higher rates, are in specific neighborhoods. So what if we want to start looking at, again, those indicators that we discussed that we know are related to social determinants of health? And so what if we want to pull in a built environment indicator? So this is sidewalks, and right here we have over 170,000 sidewalk segments. So negotiating this outside of GIS is really hard, but right now we can look at 170,000 data points and begin to make sense of it pretty rapidly. So this is just colored by the width of the sidewalk, and everybody knows that those really narrow sidewalks that are poured with the curb that are 2.5 feet wide aren't really useful in terms of walking on. and you can see exactly where those are in this diagram with the red sidewalks. The ones that are a little bit easier to walk on, that are 5 feet to 6 feet wide, we can see are kind of in the interior of the city, while the widest ones are kind of downtown. But GIS really helps us to make sense of this information really quickly, and we can then begin to compare it to, for instance, obesity, which we just looked at. And then what if we wanted to look at tree canopies as it relates to, is it a nice place to even walk around? And again, we're looking at hundreds of thousands of records, and we can immediately summarize it in an easy, understandable, well, in this case, a map. And we can see that those areas with the bigger sidewalks that have more tree canopy, more shade, and there are less trees in those other areas. And another thing that we might be interested in is parks and open space. So we can begin to look at, are there places to even walk to and recreate as it relates to kids being able to move around and not be sedentary. So we can pull that in. We can look at crime. We have almost 500,000 crime incidences that we can, again, begin to immediately understand and see where that may be affecting our ability to go outside and feel safe. I did not put this index together. However, you could imagine being able to pull all of those indicators together to create some sort of walkability index. So being able to pull together those millions of data points by a geographic region and make sense of it very quickly. Again, it would be really hard to do without the use of GIS. And then we could begin to look at food retail. Sorry, I think those circles got were a remnant from the first slide, but we can look at where those food retail locations are and whether or not it's primarily convenience stores or they're supermarkets. So right there, again, we're looking at about another 600 data points. So we can put all these together and we can just begin to get a better understanding of the community and the differences within a community, and really begin to nail down those issues around equitable distribution of resources, and the people that are experiencing those issues, and how that can ultimately relate to the health outcomes that they're experiencing. And so again, all we did was we took those tables, and essentially we could look at them in a tabular format, or we could look at them in GIS. And so we really didn't do anything except bring that table in, and it just makes for a much easier way to consume and begin to summarize and understand those data. So I want to show another quick example. So moving into more of how we can begin to do some descriptive statistics, because that first part was just sort of, let's represent the data and let's just get it into in a way that we can understand. So this is not an actual analysis. However, it's just meant to illustrate some of the ways that we begin to make sense of if we can pull together all of those different types of data sources at different geographic levels, at across those different topic areas, and make sense of them together. So in this case, we are going to look at diabetes hospitalization rates, and maybe so we'll look at minority races, income, families living at or below poverty, and then individuals that don't speak English well, and perform some just basic descriptive statistics to summarize and describe the characteristics of the neighborhoods and census tracts. And we could, again, put together a handful of bar graphs, tables, trend graphs, to look at any of those indicators. However, understanding them all together is what we're ultimately trying to get at. And it's difficult through just standard sort of the traditional ways that we begin to do our descriptive statistics. And so if we look at how we can do that, the end output we ultimately can put together would be to look at how these indicators cluster together, and both cluster in terms of their values, but also across, say, Colorado. And so if we look at, this is just a kind of end example of it, but with all of those indicators, we can come up with 6 distinct groups. And if we look at group 3, and you can see how the distribution is across the Denver metro area. Group 3 is the green tracks, where it's sort of that outside the outer suburban belt around the Denver, around the city of Denver. And it's about a third of the census tracts, or a quarter of the census tracts in Colorado, and they have a fairly low diabetes hospitalization rate of around 850 per 100,000. They have roughly about 7.5% Hispanic and less than 2% African American population. And they have a family or household income of just over $100,000. And they generally, obviously, that leads to a low poverty rate, and they, for the most part, speak English pretty well. But if you compare that to group 4, which is about 7% of the census tracts in Colorado, we have a diabetes hospitalization rate of about 4 times that, at 3,300 per 100,000. The population in terms of race and ethnicity is about 10 times the Hispanic population, 3 times the African American population, and a third of the annual household income. Poverty is about 10 times as much, obviously, because the income is much lower. And we have about 10 times the amount of people that don't speak English well. So we can begin to group these indicators, or these social determinants of health, by how they cluster together, both in their values. And then if we look at the map, we can see that they are also geographically clustered in terms of the areas or the communities that where they live. And you can see that group 4 within sort of the west side of Denver, and right around the Arsenal within Adams County, and in parts of Westminster, and then that East Colfax corridor, versus the third group that, again, is the suburban areas surrounding the city. And if we look at it across the whole state, this is how those 6 groups sort of play out. And so this is just an easy way to do some basic descriptive statistics around multiple indicators that we know have some sort of interaction and are going to be represented differently within different communities. So again, looking at group 3, this is just generally the makeup of the population of group 3, and group 4, the contrasting group, would be a smaller percentage, but using a GIS to do some basic descriptives allows us to really kind of illuminate these disparities that are occurring in the social determinants of health that are playing a factor in this. And so, again, seeing how we can do descriptive statistics a traditional way or within GIS, I think that using a GIS system just lends itself to a better understanding of what's going on. So as far as expanding our understanding, use, and analysis of non-traditional health data sets, I think that GIS really kind of facilitates these 4 points that we just discussed. So the next topic is improving data visualizations. And after that, we're just going to look at some web-based data tools. And I think that these two concepts overlap a little bit. So, but these are going to be much shorter. So historically, this is how we've pushed out data as a profession. We do a lot of tables, a lot of trends, and they are useful to certain people, and they're not very useful to other people. We can take that same information and put it into a GIS and begin to create, in this case, we created a heat map, which is much more engaging in terms of those same data points and being able to communicate what's going on, and knowing that there are differences across, in this case, Adams County, in the way that people are experiencing opioid overdoses. And so if we begin to look at some just basic social determinants of health, we can look at education, income, unemployment, and health insurance. And if we just downloaded the tables, we could pull apart the census tracts, and we could see that the top 10% of census tracts have a certain range, and the bottom 10% of census tracts have another range. So this is Arapahoe County, and we can see that for the top 10% of census tracts, we have up to 80% of people living in those census tracts with a college degree or higher versus some that are at 6%. We can see that there's a huge disparity in income across census tracts, where the top 10% of census tracts are well over $100,000, while the other ones are well under $40,000. And that unemployment is drastically different. We always hear that we have such a low unemployment rate, but we have some neighborhoods that have almost or over 20% unemployment. And same thing with health insurance, where we have been talking about how more people are enrolled in health insurance as of the last 10 years. However, we still have neighborhoods that have very low health insurance rates. So if we downloaded the census data or the American Community Survey data and just stayed in Excel, we could look at it this way. But then if we put it into a GIS, we can really begin to understand that where those things are happening are in specific areas, both for those that are doing really well and those that are not doing as well across those indicators. And this just makes it, the combination of all of this just makes it a much more effective way to communicate the results to whether it's your program or your city council members or whoever is interested. And if we were to take all of those neighborhoods and then just put a dot on the tracts that are doing well and those that are doing poorly, and just begin to, again, summarize these data in a way that, and visualize them in a way that begin to increase the overall understanding. I think that most people can understand this pretty well in terms of, okay, all the orange dots are in one spot and all the blue dots are in one spot. But then you can begin to look at other things and begin to really kind of highlight those inequities. Because what if we look at where the percent of populations who are non-white live? And so the dark areas are 60 to 90% people of color versus the light purple are 10 to 40%. But then all of a sudden, if you just look at those side by side, you can begin to develop narratives and stories around what's really going on here and sort of highlighting those disparities. And it's really difficult to do outside of a GIS system. And then if we, so in this case, we have firearms, we can begin to, if we just map those out and visualize them, we can see that if I were to report out firearm homicides and suicides for the city of Aurora, we might just think that that experience is the same across Aurora, even though, because we've narrowed down to a specific municipality. But we can see that that is not the case in Aurora, that homicides are a problem in specific areas of Aurora, while firearm-related suicides are a problem for a separate part of Aurora. And so these visualizations really do help us understand and provide some context around those health issues. So the next thing I want to talk about, which is very similar to what we just talked about in terms of visualizations, is just using GIS as a web-based data communication tool. And I think that most of us have probably seen this web map that was put together by Johns Hopkins, and it's the coronavirus and just cases of the coronavirus, and it's I think I've seen this all over the place in terms of social media and on the news, and it's extremely effective in conveying a lot of information really, really rapidly and understanding the significance of the problem and where the problem occurs. And so I just want to show you a few more examples of how these web-based data communication tools can really facilitate a conversation around understanding social determinants of health and issues of health equity. So print maps are what we've done in the past in GIS, and there are some limitations to print maps. I love print maps, but it's hard to show lots of data in a print map. You're limited to just a few indicators. Any additional information has to be contained within a legend or a label. You're fixed to the scale, so you can't zoom in and out. You show the display, and that's the resolution that the viewer can see it at. Maps can still be confusing for a lot of people, especially when you start getting lots of information on there. And to put together a really nice print map requires some graphic design skills, which some people may or may not have. And they're just hard to update when new data come around. With a web-based tool, this is the exact same map, but this is a web-based application. And you can then embed all sorts of other information. So I can include within a neighborhood or a census tract all of the demographics about that. So if we are looking at, in this case on the right-hand side, we're looking at hotspots for teen pregnancy. And so that hotspot for teen pregnancy is outlined in that purple blob right there. But we could click on the neighborhood within the purple blob and then begin to look at all of the neighborhood characteristics that we found to be important related to teen births. And people can then choose what they want to see, what they want to check on and off. And so it becomes a much more interactive experience, and their ability to understand all of those social determinants of health is just, it just grows exponentially to be able to include this much information relative to a print map. We can also include trends over time. So in this case, there are tabs across the top where we can see how opioid deaths have affected different communities over time, and where that where the concentration of deaths is shifting across the community. We can put together dashboards where we can look at all the indicators that we can possibly collect and put in one spot, and allow people to interact with the data in a way that both it's much more effective than say a report, but at the same time you can simplify a lot of what you're showing, because for instance on the trend graph you could just show Adams County rather than showing say all 64 counties of Colorado in one graph. And so users can then begin to select what they want to see or what's important to them. And this is a Asian health or Asian demographic site that we put together for one of our partners in our community. And again, you can begin to look at, on the right-hand side is all the data in one spot that's put in one of these data sites. And you can look at the population, the foreign-born population, all the different race ethnicities across the different counties, and then all the demographics by census tract. So you could just click on the map and find where there's a lot of Asians and the characteristics of the Asian population there. in addition to several health outcomes. So you're able to put together a lot of information into a kind of simplified format that is just much more engaging than a report. And then finally, putting it into a web-based format allows you to share the raw data with whoever is out there, and they may be interested in doing their own work. So all of the data that we put on our data website is available through, they can download a table, a shapefile, use a REST endpoint or an API, or just create an ArcGIS Online account and then bring it into their own maps. So it really facilitates this idea of making the data publicly available and allowing other people to then use it for their interests, whether it's emergency preparedness or, I mean, you could just, it covers a huge variety of topic areas in the same way that we're trying to consume other people's data, say crime data or food data or educational data. So, so being able to share our resources with people, I think, is one of the big things that public health can bring to the table as well when it comes to kind of really understanding these topics. And so I'm not going to go over all of these points, but these are sort of the key points for why using GIS is beneficial in understanding social determinants of health and health equity. And so I'll just close and take any questions that people might have.
Awesome. Thank you so much, Adam. That was really informative. And I think seeing all those examples are really useful so that we can all visualize what this actually means, how to do it, and how to look at data differently. So thank you. We'll now open up the Q&A. So I didn't see any questions come up through the presentation in the chat box, but you're welcome to either comment in the chat box currently. I'll read out your question for Adam. But if you prefer, since we don't have any questions in the chat box at the moment, you're also welcome to unmute your line to ask Adam a question directly. So I'll give folks a minute to do that and just be respectful to avoid talking over other folks, as we do have a bunch of folks on the line here today. We do have one question in the chat box from Andy, who asks whether you got the NIBRS data through the National Archives of Criminal Justice.
I'm not sure I'm familiar with NIDRS data.
Maybe we can ask you, Andy, to follow up.
Oh, no.
Sarah had a question about, for organizations that want to start using GIS, where to start? What would be your recommendation?
So the Esri GIS, so ArcGIS, that software is not a cheap product to just go and buy. However, there's an open source GIS software platform called QGIS, which is equally as robust, and it's the equivalent of, say, SAS versus R. And so and there's a lot of documentation as to how to use that, but it would require a little bit of just going out and either learning that on your own, and it's not, I mean, I guess for people that can pick up software, it's not a huge undertaking, but the software program is fairly big, so it can seem kind of daunting, but just downloading QGIS, it's a free platform, and there's a lot of data available, spatial data that's available online that can be brought into QGIS, so you don't even need to be creating your own data. You can literally go and get census data, you can get built environment data, FEMA data, EPA data, and you can bring it straight in and begin to interact with it immediately. So I would probably recommend just downloading QGIS and just kind of reading up a little bit about how to use it. And I think that if you watch a couple of YouTube videos, you can get you can begin to navigate it pretty quickly.
Great. The next question we have is from Nami, who asks, what are some of the challenges of using GIS for health equity data analysis, and how can we make this bidirectional and incorporate community voice in data collection?
So I think the biggest challenge would be that around this idea of the ecological fallacy, where we begin to show these data and people begin to make assumptions that something causes something else just because it's in the same spot. And what we're doing with GIS in this case would merely be to describe the conditions of the neighborhoods in which those events happen, but you're not necessarily describing the conditions of the individuals that live in those neighborhoods, if that makes sense. So trying to avoid drawing those conclusions about those indicators and kind of framing it in the context of we're really describing different communities and the conditions of different communities in different neighborhoods, and getting people in that same mindset without drawing inaccurate conclusions. And what was the second part of the question?
The second part was on how to make it bidirectional and incorporate community voice into data collection.
Yeah, that's a good question. I think that's something that we're always working with, and I are trying to do. And I think that I don't see GIS as just being a singular, like it's not, this is a GIS project. GIS just happens to be one of the tools within the whole, whether it's you're using Excel, whether you're using SAS, whether you bring GIS in. It's just a tool to get one step further down in the project. And so it's never going to substitute going out and working in a community and having people who understand the community and can bring that sort of qualitative data to the table. There are some data collection tools that can be used within different GIS applications. So you could do surveys that are location-based. You could bring in imagery that people could then, that community members could bring in. But again, it's never going to replace that sort of qualitative component of understanding a community. It just works really well for the kind of analytic, quantitative part of it.
Yeah, thank you. Aluna asked, any tips on how to utilize GIS to forecast long-term trends or health forecasts?
For health?
Mm-hmm.
So if I'm understanding the question correctly, I mean, if you were to, you would want to look at trends in a neighborhood and potentially say, like, this is going up, this could potentially go up in this area.
Talk about the low weight birds moving from
Denver to. Okay, and so we've done something similar at Tri-County. So I worked with Denver Public Health in a project looking at Black infant mortality. And what we tried to do was assess how that was moving over time. We weren't necessarily forecasting it, though. It was looking historically at how patterns of gentrification and using that as sort of the basis for understanding where Black mothers live and
going down.
Yeah, and to see if rates are actually going down in Denver, or was it just a shift in the population that was moving out of Denver because they could no longer afford to live there and moving into Aurora. And we did see that it did look like there was a shift in just the population, but that's not necessarily forecasting. But it does get at the idea that you could use GIS to look at how your populations are moving and to see like issues around gentrification, or if you live in suburban areas, you can see where those kind of growth boundaries are expanding into, to then be able to say that a certain demographic, that there's demographic shifts in the population, which for the most part, we can predict a lot of health outcomes based on the demographics. So it's not necessarily forecasting, but it's that's the best answer I have in terms of how you could use it as forecasting.
No, I think that's really helpful. The last question at the moment is whether GIS registers locally collected data, such as a county-based community health assessment or something similar.
I'm slightly confused on what it means to register local data. I mean, there is local data available that we use and that we have used for our community health assessment. So for instance, we have all of our vital records data has an address, and so we can get down to very specific parts of a neighborhood that are experiencing say opioid overdose deaths or low weight births, and we have a lot within the vital records data set. I mean, I think that's one of the strongest data sets we have out there, just in terms of its utility and being able to use it quickly. And it has a lot of demographic information about the individuals who've either given birth or have died. But I'm not sure that that's necessarily getting at the question related to locally registered data. You could bring in data as well if you say you were doing resources in facilities in your community. But if she wants to email me, and I can clarify that too if I didn't answer it.
Wonderful. Thank you. Did anybody who is on the phone want to unmute their line to ask a question just in our final 2 minutes together? I'm going to give folks a chance, so feel free to unmute your line if you're interested in asking Adam a question directly.
I already asked a question, but if I can ask another one.
Yeah, feel free.
I'm not quite sure how to phrase this. I guess the question is, are there things that we might miss by focusing on a spatio-temporal kind of mapping like this as far as public health data?
Are there things that we would miss?
Yeah, like what are we measuring outside of space and time? Is there anything that you can think of?
Space and time. Context, you mentioned that.
I mean, I think the main thing would just be this is looking at really that quantitative data, and that without really planning on how you get this information into GIS, we'd be missing out on that sort of qualitative part. And
yeah, that helps. Thank you.
oh, yeah.
Another question? We're just nearing the end of our time together. All right. Well,
Sorry, this is Ashley. I've been stewing on a little bit of a question that feeds off of what like NAMI has been getting at. I want to thank you, Adam, for your time in showing these. And I keep coming to mind on that image you were showing about Arapahoe County with the blue and the orange dots, and then the race demographics listed above it. And it was getting to me, like, I know that showing these can lead to people's natural kind of conclusion that people of color experience, I think, whatever health outcome, I think it was diabetes at a higher frequency because of their race. And then without the context that, like, no, that's actually not the case, we kind of leave people to draw that conclusion on their own. Is there a way that more context can be provided when showing equity data that kind of like eradicates the opportunity for people's natural conclusion to be drawn, or seemingly natural conclusion to be drawn?
Yeah, I think that's where coming up with that qualitative context that you would get from really understanding your community would bring that into focus. I don't think that, again, this GIS component is just one component of looking at the quantitative data. It needs to be used in conjunction with developing that narrative, developing the communication piece, bringing people's experiences into it to really kind of lay it out there. I always look at these New York Times sites, and they're what I kind of strive for in terms of laying out. They have this, it's called the upshot, but it lays out the data, it lays out the mapping, and then it lays out people's individual stories about what has really affected their ability to on whatever topic that they're doing. And so yeah, us not just leaving it at a GIS or quantitative analysis, but working through the whole process of telling the story, I guess.
I like that. Thank you.
Thank you, Adam, for this great presentation. The link to the slides is in the chat box if you're interested in downloading them, and all of those links that Adam had spoken to are in that presentation. If you're interested in a link to the webinar recording, feel free to email me at marissapisbrook@gmail.com. I'm happy to provide those to anyone who's interested. So thanks again for your time. Hope to see you all again soon on another webinar.